Medical cannabis shows promise to treat cocaine withdrawal symptoms. Recent studies have found that cannabis derivative may be effective in reducing the withdrawal symptoms associated with cocaine and methamphetamine use. CBD treatment has been linked to a reduction in cocaine self-administration. Addictive substances such as cocaine can have a damaging impact on the user's brain function, with the drug abuse policy leading to seizures, strokes, myocardial infarction, and acute liver injuries. While there are no approved treatments for cocaine addiction and addiction to other psychostimulatic drugs, some studies found that CBD use could be useful in mitigating the withdrawal symptoms. As Gary L. Wenck, PhD, wrote in the Psychology Today magazine, withdrawal symptoms are the result of exposing the brain to the chemicals, including drugs as well as sugar. When it happens, the brain adjusts. This explains why, when we suddenly remove the substance, in the case of cocaine, the brain demands its return. Following long-term cocaine abuse, he continues, it is now known that there is significant effect on the gene expression in the brain. More precisely, the brain's reward and pleasure-related neurotransmitter systems, dopamine and endocannabinoids. The result of a recent study cited that Wenck's article shows that mice exposed to spontaneous cocaine withdrawal presented increased motor activity, somatic withdrawal signs, and high anxiety-like behaviour. Researchers concluded that CBD normalised motor and somatic signs. Moreover, they say that CBD treatment corrected changes in the gene's expression. Elsewhere, Marijuana Moment cites a study published in the Pharmacology, Biochemistry and Behavioural Journal in which researchers analysed more than a dozen animals assessing their reaction to CBD treatment in cocaine abuse. The findings of this review were equally promising. The paper quotes, CBD promotes a reduction in cocaine self-administration. Also, it interferes in cocaine-induced brain reward stimulation and dopamine release. CBD promotes alteration in contextual memory associated with cocaine and in the neuroadaptations, hepatotoxicity, and seizure induced by cocaine. The findings of these studies demonstrate that CBD could be a promising option for the treatment of cocaine dependency. However, researchers stress that more clinical trials are needed to determine whether the success of the animal trials will transfer to humans struggling with drug misuse.